Dr. Mong, it's great to meet you and welcome here. You have been a regular consumer of Max Hydration, so can you tell us what makes this product appealing to you?
So I was introduced to Max Hydration probably over a year ago at this point. And at the time, both my husband and I are pretty active athletically, and he specifically was having a lot of trouble keeping up with volume deficits that he was experiencing, and would have lots of muscle cramps and just fatigue, different things that was making him feel pretty poorly. And sure enough, last night I woke up with a muscle cramp. Now, is it directly related to that? I can't tell you 100%. On the other hand, I do know that really I've been feeling a lot better personally over the last few months since starting to use this more. And I know my husband has too. So I am a board certified internist and pediatrician. I practice in the adolescent medicine space where I treat adolescents and young adults. I end up seeing a lot of athletes. I also end up seeing a lot of patients who have problems maintaining their volume. So I think that Max Hydration has been able to, in a smaller volume, be able to accomplish more effective volume repletion. It also, to my taste, is better. And the palatability of it has been really appealing. I am not the biggest fan of a lot of the things that are on the market in terms of their flavor profiles.
Mm-hmm.
I feel like a lot of them taste too salty or too sweet, or there's just nothing that I've ever found that I really like quite as much.
Mm-hmm.
And so this twofold is, one, it tastes good, and two, the volume needed often for me is less than the volume that I have needed in other products.
Mm-hmm. Do you see there to be any reason why someone wouldn't use it? Like, have you noticed anything that stands out in your mind?
To my knowledge and to my experience, I can't think of any reason why someone would not choose Max Hydration product as a source of volume repletion. I think it's really a great option. In patients that I've recommended Max Hydration, if they are using it regularly, even just one kind of packet a day, they have told me in the following weeks that they actually feel less dizzy a lot of times. I can sometimes have measurable changes in their blood pressure and what we call orthostatic tolerance, so their ability to maintain their blood pressure and not have their heart rate spike when they stand up. So I have been finding it to be effective, and often has prevented me from needing to send people to the emergency room for IV hydration.
Oh, that's great. Considering the current situation with the virus and the impact that it's made on people, the change that it's invoked in our daily activities, routines, it sort of makes me think that we've started a new chapter in history, things that may never go back to being the same, that we're sort of accustomed to, or at least to some extent.
So with COVID-19 and the mandatory masking recommendations that are kind of universal in many places, what I'm seeing on a practical level is that people are not actually accessing hydration as often. So they have a mask on, they're working with a mask on all day. You have to, be very careful about touching your face, about moving the mask. So what will happen, even I see it in my own practice, is we don't drink as much, right? So we're not actually hydrating as much as we should be throughout the day, comparatively speaking to when we weren't masking. Obviously, the masking is very important to prevent transmission of the virus. However, it's having secondary effects, I think, in the way that our bodies then are hydrated or not hydrated appropriately.
Mm-hmm.
So I view it as effective. So then we want to make our hydration as effective as possible and keep our volume high, which electrolytes are critical for that. Again, going back to water in and of itself can only do as much as you have a functional kind of transport system, which requires sodium and glucose.
Mm-hmm.
And so that then allows the water to actually be absorbed better. So if the little bit of fluids that you're getting throughout the day are just water and you have extra losses, for example, people are wearing a lot of personal protective equipment, they may be sweating more, exercise may be looking different for people. I think there is this risk right now that our electrolytes are not being repleted as appropriately as they should be. Thus, if you are drinking something that contains both the hydration part of it and the electrolytes,
Mm-hmm.
you're going to have a more efficient way to replace those losses.
In general, have you had some feedback from patients that you have previously prescribed this to or suggested it to?
The feedback I get from patients after I recommend Max Hydration is generally they find it to be tasty. They like the taste of it, which is not always the feedback I get from people about other things on the market. They also find that it is relative, the cost is not a barrier for them. So they feel like it's at a good price point where in terms of efficiency, it makes a lot of sense. And then for a lot of my patients that use it regularly, they feel better. So that they actually will tell me they feel better. And all of those things I think are really important. And even if clinically I don't have specific numbers on them, you know, this certain measure improved by 5 points, really our goals are to help patients feel better. And so if this is helping patients feel better, then I think we're achieving the goals, even if I don't have specific numbers to guide that. So what is happening with them from their perspective is if they feel better. Thinking back on kind of my last couple of decades, I was a Division I athlete back in college, which has been a long time ago. But I think about my hydration and kind of what we were doing at the time, and it was very kind of your traditional hydration products in the 1990s. And I often wish that we had something like this product, Max Hydration, at the time, because I really do think that it probably would have helped us as athletes training, as I feel like it really has substantially aided my own recovery and certainly in my husband as well, just from our workouts now at this point in our lives.
Dr. Mong, listen, it's been a real pleasure, and first to meet you, and thanks for coming and speaking with us today.
No, it was great to speak with you, and I'm happy to follow up on anything later if you have other questions.